David Silverstein is the founder and chairman of BrokenHealthcare.org, and he's willing to join us right now. Mr. Silverstein, good to have you coming down the road with us.
Joel, thanks for having me.
The obvious question is, what is BrokenHealthcare.org?
BrokenHealthcare.org is a nonprofit that is really my outlet for my frustrations with the healthcare system. So I created it years ago after getting angry at the system, and now it provides advocacy to people facing medical billing nightmares, and from there also trying to drive the public policy changes that would avoid many of the problems we have in the first place.
So what happened to you? Because all of us have that kind of a story to share. What happened to you?
Yeah, so it was about 10 years ago. My then 15-year-old daughter was playing basketball, a scrappy little player, 5 foot nothing, 100 nothing pounds, playing with some of the boys, takes a charge, wound up with a minor concussion. ER bill came a month later, and she's looking over my shoulder at the kitchen counter at this $12,000 bill. And she's got this look on her face that I couldn't figure out. I finally realized it was guilt. She was feeling guilty about being responsible for a $12,000 bill for this minor bump on her head. And so she started peppering me with questions. And I don't know about you, but when I have to explain something out loud to my kids, it's a very different experience than just knowing it up here. I knew how crazy this system was, but I'm explaining it to my daughter and she's looking at me like I've got two heads. And so we wound up, without going into the whole history, that's what ultimately led to Broken Healthcare. We started challenging some of our own medical bills. We were just so astonished at the answers we would get from hospitals about our bills. One of them said, "I'm sorry, sir, we can't give you our prices. Those are proprietary." So we wrote back and said, "Understand completely. Turns out our credit card number is proprietary too. So how do we get past this impasse, right?" And so we started having some fun with it and pushing back more and more. And the more questions we asked, the more crazy answers we got. That's what ultimately led to creating Broken Healthcare. We said, you know what, a lot of other people must be dealing with the same things. We need to figure out how to help them. And then took everything that we learned doing that and realized it's time for some public policy changes as well.
So when you got into your particular case, did the healthcare industry locally, now the individuals that you were talking to, how did they react to that? Was it like, this is the bill, put up or shut up, this is the way it is, tough break?
Oh, yeah.
Did they begin some sort of negotiation?
No, the first letter of responses we got were clearly form letters. And then I started asking harder and harder questions. Ultimately got on the phone with the hospital billing office and said, look, I know you're just doing your job. I get it. Please make sure your hospital knows we're not paying these bills. Then we got to the controller for the hospital, ultimately got to the CFO of a $20 billion hospital system. And he said to me, Mr. Silverstein, what is it you really want? I said, well, what I really want is for you to sue me. He said, you want us to sue you? I said, I do. I said, let's look at these three. By now we had three bills. It was a couple of years later, my daughter managed to find her way to the emergency room 3 times her freshman year in college. So I said, yes, I want you to sue me. He said, I don't think anybody's ever said that to me before. Can you tell me why? I said, sure. Let's add up these 3 bills. They total about $20,000. If I had to pay you $20,000, I could. I'm not happy about it, but I could. So my exposure is $20,000. Your exposure is, and he finished the sentence for me, the discovery process. I said, bingo. I said, so I'm looking for you to sue me so I can get answers to all of my questions and put the answers out in the public domain. And to make a long story short, they didn't sue me. Instead, they just walked away from all of the bills because there was no way they were going to submit themselves to that process. And so that became the foundation of what I call the denial of payment system. We have figured out how to deny payment without allowing somebody to damage my credit report, without allowing them to successfully sue me. But I'm lucky. I've always had an attorney working for me in one of my companies who's a world-class litigator, so I was able to do that. The average American can't do that. So that's why Broken Healthcare started doing it for some people, helping them do it as our way of pushing back and probing and that type of thing. And that's how we learned what we needed to learn to go and start to drive public policy changes.
I'm curious, during that whole process, before you got to that point where you looked at the individual and said, what I want is I want you to sue me, how much interest was threatened? How much additional expense was threatened to you and your family?
Oh, yeah. I mean, we were getting letters, this bill is going to be sent to collections. And so it never actually made it to collections because I created such a dispute that no collections agency would have taken it from the hospital. So it really got bound up in the hospital. So, but you're 100% right. Especially when bills go to collections agencies start adding statutory interest rates, which vary by state because they're all licensed at the state level. But even in times of 1%, 2%, 3% interest at your bank, 4% mortgage rates, sure, a collections agency might be tacking on 8% interest, 10% interest, 15% interest, depends what the laws in your state allow them to get away with. And it just grows from there. I mean, the number of people who are having their wages garnished and who are going through just severe financial distress, I'm willing to bet that a large number of these mental health challenges, we keep hearing about the mental health crisis, how much of that anxiety and those mental health problems are being caused by medical debt in the first place, right? I mean, it's just it's 20% of our economy. It's the craziest system in the world.
Well, I looked at some suicide numbers once in my days in the North Dakota Senate, and what I found was that one of the common threads of suicide was medical, I should say, bills.
Right.
Medical bills that they couldn't get out from under. And this was something that they just said, look, I mean, this is what I'm doing to my family. And it coincided with the type of stress that caused suicide. And I don't think people realize that. But
so much for do no harm, right?
Yeah.
So much for do no harm.
Yeah. I mean, you must, in all of your work and advocating for people, you must have seen some of that, David.
Oh, my God. So there was a hospital system that we had decided to take on in Northern Virginia, Mary Washington Hospital in Fredericksburg, Virginia. They were suing literally hundreds of people on a monthly basis. This hospital owned its own day on the court docket. The sign on the door to the courthouse would say, Mary Washington Hospital cases only today. I think it was the first Friday of every month. So there was one woman that we helped there. Her name was oh God, I can't even remember her name. But anyway, mother of four. She was, I want to say, 38, 39 years old. Her husband had been in the military. When they came home from Korea, he kind of fell apart. So she'd been supporting her family, 4 kids, her husband in Korea, which means she hadn't worked in over a decade, right? Stay-at-home mom, taking care of her kids. Husband falls apart. They get divorced. So now this single mother of 4 trying to do everything right. So she moved in with her mother, took out student loans. She's putting herself through school while working another job, while caring for 4 kids. She's doing everything right. All of that stress caused her to have a very minor stroke. She spent a few days in the hospital. A year later, that hospital is suing her for what she earned in a year. But it's worse than that. So you've got this basically impoverished family where mom is trying to do everything right, the American way, working her butt off. And she applies for financial aid from this nonprofit hospital, and they deny it. You know why? They said the household income was too much. So because she had moved in with her mother, the hospital wants to consider her mother's income. You know what? I don't know what her mother made, $50,000, $60,000 a year, right? And so this woman gets punished for doing everything right in this nonprofit hospital that wants people to leave them in their will and make donations for them, looks for any way they can to even turn down the most basic of when charity care is appropriate from a non-profit hospital. And so that's how crazy the system and how terrible the system has become, is they don't even want to do not charity care anymore if they can find a way out of it. And that woman she was doing everything right, and the system was just crushing her.
You know, the great thing about doing this show is you get the chance to meet people like David Silverstein and find out what drives him. You know, we heard in the last segment what caused him to get active in all of this, and what caused him to make sure that other people knew about his case and what could happen with their case. He runs, and he's chairman of BrokenHealthcare.org, which is worth your search. do the Google, do whatever you call it, and go on your search engine and find it out. David, before the break, we talked a little bit about how, you know, you're dealing with an accountant, you're dealing with somebody that's talking to you about money, what you own, and your acknowledgement is, look, I know this isn't your problem. This isn't, you're just there dealing with the accounting issue. I guess I'm forced to ask you, where do you fix this? Is it at the CEO level? Is it at the congressional level? I mean, if you're going to fix this broken system and what it bills all of us, where do you fix it?
Sure. So the answer is actually really straightforward. Our healthcare system is a broken economic model. It's the 5th largest economy on the planet, just the American healthcare system, which means it's the same size as Germany's entire economy. And it's economically dysfunctional. In other words, we have the greatest consumer society in the world, and we are denying Americans the ability to be consumers. So on January 1st of 2021, so just a little over a year ago, a new law took effect at the federal level. That law requires your local hospitals to publish every single price. What they call their list price, which in hospital parlance is their charge master, their cash pay prices if they offer a discount, and the price they've negotiated with every single insurance company. And they have to publish that so that we will have that information and we can start being good consumers. We can start questioning things. We can start putting pressure on them. We can compare hospitals. And right now they're not complying with the law. Fewer than 15% of hospitals are complying with that federal law because it doesn't pay to comply. They'd rather get warning letters from the federal government. Some hospital CEOs have said, we'd rather pay the fines than comply with federal law. Nobody's been fined yet. And they do that because the more that information is hidden from us, the less we can be consumers. And that's why prices can stay so high. That's why prices go up at twice the rate of inflation. So we have taken the basic steps. So I worked very closely with the last administration, the Trump administration, to actually write those rules. And then they took effect last January. President Biden has affirmed the importance of the rules with an executive order. So very, very bipartisan to do this. And right now, the hospitals are just flaunting the law. So you mentioned that you were a state legislator. So I do have some legislation pending here in Colorado that would use state law and force the hospitals to comply with federal law.
So what type of bite did you put in it? What type of, you know, you're saying they'd rather ignore it and get the letters and say you're not complying. What type of bite did you put in it? And does there need to be more of a bite?
So what this state law does, and it's, we passed through the first committee with a unanimous bipartisan vote last week, and we have very, very strong support. Both the majority leaders of both chambers of the Colorado legislature are sponsors, the governor is behind the bill. And what the bill does is it's very, very simple. It empowers people, has no role for government. It's a very free market approach to the problem. And it simply says, if a hospital is not complying with that federal law, when it provided you with hospital services, it cannot sue you to collect on that bill, and it can't refer your bill to a state licensed collections agency. In other words, they can send you a bill, but if you choose not to pay it, there's nothing they can do. They can't damage your credit report. They can't sue you. And if they do violate that, let's say the hospital sent your bill to a debt collector, you sue the hospital, and when they have to pay you the amount of the bill. So that's the bite. So if it's a $100,000 bill and they were not compliant with the federal price transparency rules, you would sue them. And if you win, they have to pay you the $100,000.
So you're in front of my committee. Let's do a scenario here. You're in front of my committee in Colorado. I'm a state senator there instead of what I did here in North Dakota. And I look at you and you put that bite in the bill. Okay, you put that actual action item so that they know it's worth doing what they do. And I look at you and say, look, you as a consumer needed these services, you got these services, and you should have done your homework on these services. What would your answer to that be?
Well, the hospital is not complying with the law, so they're denying me the right to do that homework. You just made your case. There is a law that says they have to provide me with the information to do that homework, and they are refusing to comply with that law. So I couldn't do it. They're denying me the right to be an effective consumer. So that's the consumer protection angle on this. The macroeconomic angle is if we all had information on the prices would be a lot lower because we would be comparing them and driving those prices down. But at the patient level, it's just basic patient protection 101. You're not allowing me to have the information that I'm entitled to by law.
So, okay, let me go another route here. You gave us the example earlier of your daughter and what began this process and how ridiculous that bill was. Doing what you're doing, and you also pointed out to, a woman that's trying to make life work and trying to do what she could do for her family living with her mother. But the expense items, the items on the list, you must have some examples of how the heck could you ever come up with the fact that you can charge that much for that. I mean, with all the work your organization does, you must have some examples that people who are watching us need to hear.
Oh, sure. We've got examples of people being charged $15,000 for an EpiPen because when you have a bee sting or an allergic reaction and you go to the hospital and you need to be an EpiPen, you're not in any position to negotiate then, right? And so that price needs to be kept in check well in advance of you ever going to the hospital. If they had to publish that price, what do you think the local news would do with that? What do you think local citizens would do? What do you think the board of that hospital would do if they had to publish that? It would never happen in the first place, right? Because that hospital would get creamed in the public eye. But imagine if you were a McDonald's franchisee and we said, you know what, you can charge whatever you want for a chicken nugget. Once somebody comes in and orders that chicken nugget and swallows it, they have no choice but to pay you whatever you decide to charge them. What are you going to charge them? You're going to charge them $15,000 for that chicken nugget because that's the American way, right? In the United States, in a market-driven economy, we pay the highest price. We charge the highest price that we can get. So there is nobody looking and saying, well, that's unfair. They can't do that. The only person to do that in the United States of America is the consumer. And so if consumers aren't given that information, there's nobody to say you can't charge $15,000 for a chicken nugget. I wish I would have known before I swallowed it.
Yeah, I get it. What about the insurance company's role in all this? Because, my take on people who think they have good insurance, right? They're like, no, I've got really good insurance, is their copay drives them nuts. It's like this much. And the insurance company really ends up being the advocate for the medical industry because they're willing to pay it. And so you, as somebody who pays the copay, is sitting there in a position where basically the big brother in this structure is willing to pay it. Talk to me about the insurance company's role.
Yeah, so Joel, you're asking great questions. So they are extremely complicit, but it's our own fault. The biggest unintended consequence of the Affordable Care Act wasn't all the things that people read about, right? Those are good headlines and sound bites, the individual mandate. The biggest unintended consequence, we capped the profit of insurance companies at 15%. We said you can't earn more than a 15% profit, including your administrative costs. So what that means is if an insurance company was able to negotiate better prices and drive costs down, they'd make less money. Usually, if you can negotiate better prices on behalf of your customers in the insurance industry, you should make more money. That's your reward for doing it and being competitive. We decided we were going to treat them and use this concept that comes out of the nonprofit world, which isn't even a good concept in the nonprofit world, which is we're going to cap how much money goes into administrative costs and that kind of thing. So by capping the profits, the only way for insurance companies to make more money is to work with the healthcare industry to allow prices to continue to rise. It was the biggest unintended we broke the economics of healthcare completely by taking away all market-based incentives for insurance companies to do the right things.
I ran a utility, David, and this was years before I got into media. And when I ran that utility, my goal every year was to try to get my employees about a 5% raise. At some point, it wasn't 5% because their health insurance kept going up and up and up. And then instead of looking at them saying, I can give you a 5% raise, I said, look, at best I can do 2-3% here because I got to pay your healthcare coverage over there. Then I went back to them a year or two later and said, look, this is jumping by 18-20%. And so, in order for you to even get a raise at all, you're going to need to have a bigger copay. And so we're going to have to change your insurance, period. And it still, the next year, went up 18% at Blue Cross. What I'm building up to as a question is, for that average worker that doesn't see the raise they could have had, and it went towards healthcare, do you think they get it? Do you think they're informed enough on it to do what you're doing, which is to fight it?
No, absolutely not. In this country, you and I did not learn when we were growing up how to manage our healthcare, how to be healthcare consumers. You learned, maybe you went with your father to buy a car when you were 15, and you heard him asking about rebates and kickbacks and manufacturer incentives. We learn life skills in school. We learn them in church. We learn them from our parents when we're growing up, but nobody taught us how the healthcare system works or how to be healthcare consumers. And because of that, that's a problem that gets perpetuated from generation to generation. Because we didn't learn, our generation is not doing a good job of teaching our kids. And our kids, if we don't break the cycle, won't teach their kids how to be healthcare consumers either. We are a consumer-driven system. But you said something else really interesting, that you used to run a public utility. Well, even though I'm not a big fan of the system, at least with a public utility, there was a public utility commission that told you what you could charge the consumer, and said it may have been higher than it should have been, and it may have been made it an inefficient, relatively inefficient industry, but somebody at least kept that in check for the consumer. In healthcare, we have the government negotiates prices for itself, not negotiates, but sets them with Medicare and Medicaid, but they are not putting any limits on what private payers like us can pay. So we have no protection.
David, thank you for what you're doing. It's brokenhealthcare.org. Do your homework. Go there. And I don't know if I should say this, but I'm going to say it. Thank your daughter for taking that charge. I appreciate it. Thank you, David, for coming on.